Healthcare topics you need and wellness tips you deserve, all straight from the doctors themselves. Maayong Adlaw, Cebu. I'm Kriya Padilla-Roleda from CDN Digital, together with the hospital at Maayo, and this is Maayong Adlaw Doc. In the last season of Maayong Adlaw Doc, we had interesting discussions with our gastroenterologists and doctors. We spoke about nutrition, bad breath, ear infections. Now, if you missed some of those episodes, you can always check out CDN Digital, okay? Check out their Facebook page, their website, and of course, their YouTube channel. And we are back for more health topics straight from the doctors themselves. Now, before we head on to that, let's watch this video first about the hospital at Maayo Dental Care Unit. The hospital at Maayo's Dental Care Unit is a modern dental facility offering affordable yet quality dental care. The hospital at Maayo's Dental Care Facility is equipped with advanced imaging systems to provide clear images that aid in accurate diagnosis. Their dental care staff and consultants aim to offer quality dental care that is hassle-free and pleasant. Here in one of Cebu's bustling cities, Mandaue, the hospital at Maayo is designed to give you the care and services you need. They prioritize your health, put your needs on top, and make sure to give you a holistic medical experience. Now, for today's episode, we will be talking about an interesting mouth problem. So let's learn more about our teeth from our guest doctor today. Our guest doctor for today is the current chairman of the Dental Care Unit of the hospital at Maayo and is a consultant for oral surgery since 2017. He became a professor as well as chairman of Oral Surgery Department of the College of Dentistry of the University of the Visayas and other notable universities in Cebu from 2005 until June 2020. Aside from his long list of training and programs that he attended and completed, he also became vice president in 2012 and a board of director in 2011 and from 2013 to 2016 for the Mandaue Dental Society Philippine Dental Association. Let's welcome our guest dentist for today, Dr. Anthony Dabon. Maayong Adlaw, Doc. Kumusta?
Maayong Adlaw.
You know, we have a very interesting topic today, and I am actually very curious about this, not teeth grinding. Because I remember when I was a kid, my brothers, every night you'd hear them grinding their teeth. And even until now, na they're grown-ups na, na-miss ko. They're grown-ups na, they still grind their teeth. So this is actually murag, para nako common. But I want to know how common this is really to us, and at the same time, what do we call this gani? Scientifically, what's the scientific?
Okay, medically we call this one as bruxism. Bruxism.
Bruxism.
Yes.
Okay.
And then it's very common for most of us experience, especially for, and this one is not harmful, especially if dili pirmi.
Okay.
But if it is pirmi na gyud, basically it will become harmful to our teeth. It can cause damage and it can cause oral complications.
Question, kinsa ni siya more common to sa bata, sa tiguang? I mentioned earlier na my brother, bata pa.
Yes.
They have this already.
So, during childhood, mas common ni siya sa mga bata. Kay especially kung kiat na kayo, so, but eventually, going to adulthood, mawala rapod na.
You mentioned common sa mga bata because kiat kaayo. Why? What causes bruxism?
Actually, there are lots of risk factors that goes with bruxism. So, the age sa mga bata is, sa age sa mga bata is common, di ba? And then also the stress and anxiety. So, increase in stress and anxiety increases the risk also of bruxism. And also, there's also for medications, so or other drugs, substances like tobacco smoking. So that's why pati adulthood na agihapon kay tobacco smoking, alcohol, or even high caffeinated beverages
Can cause
bruxism. And also recreational drugs can cause bruxism also.
Okay. Okay, you mentioned also na kids anxiety bitaw na. So siguro kaning mga when they're experiencing stress in the family or the separation anxiety, because diba there are also cases when kids would pee their beds pag...
Yes,
Oo.
yes.
So bruxism is something like that also.
Something like that.
I
So
see.
basically, like let's say ang bata is kapoy playing all throughout the day, and then pagkagabi na unconsciously, so they will do teeth grinding or clenching.
Okay. Is it also possible to grind your teeth nga awake ka? Kaya di ba common na tulog man yun. But how about awake?
Yes,
Na
yes,
cases
yes.
like
It's possible. There is awake bruxism and a sleep bruxism. So for the awake bruxism, still unconscious. You don't know
murag
na.
habit.
Yeah, it's like a habit already.
see.
So you don't know that nagbubruxism na day ka.
So you also said na it can be harmful. What are the worst case scenarios if you keep on grinding your teeth? Good?
Yeah. If it is in a chronic, like everyday good, heavy bruxism or severe bruxism, so the tendency it can cause damage or attrition of the teeth. So meaning for attrition is more siyang mabawasan ang imong ngipon through grinding. And then as goes, the tendency is it will expose your dentine and also your pulp.
So your teeth has
you have
different
you have layers
right?
of your teeth.
Okay,
You have
so
your
the first
enamel,
one is,
the strongest one. Then you have your dentine, and then the pulp is the nerve.
Okay.
So eventually,
exposed to your dentine, what happens?
sensitivity and pain. So munang makuha ka is ngilo na akong ngipon.
So a lot of teeth grinders usually have sensitive teeth.
Yes, yes. The
I
tendency
see.
for that one is it will cause you sensitive teeth, and then eventually, moabot siya until sa pulp area. If that happens, we have to do some intervention for that. Kay patient will experience severe pain, so severe sensitivity also.
Can it cause cavities? No.
Yes, it depends, but usually in attrition, it will have a smooth reduction. So if you're gonna say cavity, sometimes you will have a deeper or an isolated hole on your tooth.
Okay.
So for this is generalized, let's say, if you're gonna do bruxism, all of your entire anterior teeth will have like uniform reduction of your tooth.
When we grind our teeth ba, I'm sure you've encountered so many of this. Lahi po na, no? Is it always like concentrated on the front, the side, or asa man na?
Tanan, actually it's general. It depends on the
No,
force.
very
It depends on the force and your occlusion also.
Oh.
So depende every case lain-lain gud ang iyang
Na ay soft grinders, na ay
Oh yes. So, depende na sa stress level.
no?
Yes.
Oh, okay. But again, lahi-lahi ang causes, right? It's not really just stress. You mentioned kani mga mga different drugs,
Yes.
kaning unsa pa
Also medical conditions.
like what?
Yeah,
Doc?
like Parkinson's disease
Ah,
or
yes, we can control.
patient with epilepsy.
Yes.
And then dementia also. And then also if you have a sleep apnea, so the tendency is the patient will do night grinding also. And then if you are snoring, you have a high risk of
Why is that?
it's because of the position of your oral cavity or your
What
occlusion.
happens when you're snoring, and then how does it result to teeth grinding and
So most probably the physiologic process of that one, and then eventually it will tend for night grinding or grinding of your teeth also.
Okay. If you live alone and you want to know whether you grind your teeth or not,
Yes.
what do we do? How do we find
Yeah,
out?
because usually night grinding you will be able to know if ever that your loved one or your bed partner will be the one to tell you, "Oy, nag-night grind kagabi." But if you're alone, usually you don't know that because of
yes.
course you're sleeping. And then when you wake up, you will feel headache, a dull headache on that specific side only. And then there will be jaw and face pain. So because for a severe or a chronic type, you can cause
A certain
TMD.
part of your face
Yeah,
lang po,
in
not
the jaw,
entire
where
face.
the force is, the tendency that's where the pain goes, and then you will be able to have a TMD. We call that one as temporomandibular disorder. So it is a disorder of your temporomandibular joint. So we have here from the
that?
lower jaw, we have a joint here in front of your ears, and that's where you open and close. You will be able to feel that one.
It would hurt there.
So would hurt there, yeah.
Okay. So kana siya. Those are the telltale signs.
Yes,
kung
yes.
Ikaw raw usa.
Kung ikaw raw
Okay,
usa. So
dali raman
pag,
lagi ko na
pag
kita.
mata ni mo sakit man ang ulo or sakit man ang kuan. So basically muna siya yung
So you
mga
have to
signs.
visit your dentist also,
Yes,
no?
yes.
That
Para at
time.
least you will be able to check up everything to check.
Is there a natural way to stop us from grinding?
Grinding. So actually, any problem you will be able to stop through the cause of it. So you have to seek. You have to know what causes you with this. So, like what I said, stress and anxiety is the number one risk factor for this. So you have to control your anxiety level. So by this, you can consult for counseling, or you can do some exercise, yoga, para at least ma-relax lang yun ka, para during sleep, relax yun ang pan.
How does alcohol and other drugs cause teeth grinding?
It's a chemical reaction because it's make it hyper. So like for tobacco smoking, for the caffeine, so it makes you. It's like you're asleep na pero some of your muscles still working. So unang you do your grinding, and then definitely the recreational drugs. Somewhat yun na maka-cause yung teeth grinding.
Are there any other effects other than katong ma-expose ang dentin?
It can cause also loosening of your teeth because of the trauma. So muuyog siya. Pwede siya muuyog. Kaya syempre, sige kaigo, eventually, mu-weaken yun ang periodontium or the area what holds your tooth.
That's sad.
Yeah, that's why you have to check it from time to time.
Is there also about food? I don't know, no? Are there food na we need to avoid if we are teeth grinders and
actually wala naman. You can eat anything if you are teeth grinding. There's no contraindications for that.
Or exercises which can actually prevent us from teeth grinding. Are there?
Yes. I'm not sure with the specific exercise for that one. Usually, we refer that one for your physical therapies, for at least ma-guide ka for relaxation, because there are some exercises that are very strenuous that mo level up ay mong stress. So, kailangan mo exercise, it will make you more comfortable or make you less stress or less fun.
Do you also work with these other medical practitioners, no? Like you mentioned, physical therapists. Like, have you ever had cases wherein you had to work with a psychologist or with a physical therapist?
Actually,
because of these cases?
if in specific cases like that, we refer to a specific departments, and then by then through call. So what will be your diagnosis, and then you will ask them what will be their treatment, so that you can coincide. But basically, work hand in hand like tupad yun. No. So we'll just refer it to them, para at least they will do their part, and then patient will come back for another evaluation.
Are there, what do we call that? Appliances, right? Are there appliances that we can use, and how do they work to prevent or to help us?
So we have appliance. That's one of the treatment for that. It's the dental appliance or mouth guard. So we have two kinds of mouth guard, a soft one and hard one. So the purpose for that is to cover or to protect the teeth. So by that, it will raise your bite, and then eventually it will relaxes your muscles also.
And how often, when do we wear this? During nighttime?
During nighttime. So when you sleep, you have to wear that one.
How about if you grind your teeth in the morning, can you wear also the mouth guard? Unconsciously by you grind your
If
teeth?
ingana nang ka grabe, yes, you can.
Pag inana ka grabe, Doc, ba? Other than kana appliances, what else can we
Actually,
do about
pag
it?
kanang ingana na ka grabe ang kwan, you have to go for the main cause, the etiology of the problem.
Cause yun, no?
Because what we're dealing like for the mouth guard, that's we're treating the symptoms, but we are not treating the cause. So we have to treat the cause. We have to go underneath the root of it, and then so that everything will be treated.
Yes, that's why it's important na you also work with other medical practitioners
yes.
to really address your case.
Yes.
No? Not just, don't depend on the dentist. You have to go to the cause.
Yes.
I think that's what Dr. Dabon has been emphasizing earlier.
Yes.
There's a cost to that thing.
Yes.
There's always a cost. Okay.
There's you have to know, so diagnosing a problem is one of the most challenging. So you have to dig out everything.
And there are so many causes you mentioned, right?
Yeah, they're possible. Pero actually, teeth grinding still unknown pag yun ang specific cause. But these are the risk factors. These are the possible things that triggers your teeth grinding.
I know I asked earlier and then you mentioned more common, but how common is common kaning teeth grinding in Filipinos?
Actually,
or even worldwide.
In my practice, that's about 80% of my patients experience teeth grinding. So,
but not all is kanang
not all are chronic or severe.
Chronic.
So, I'm pretty sure all of us experience teeth grinding.
I think I'm even grinding my teeth right now. Sulbaan ka slightly.
Yes. So, kanang iyan ang kuan ba? So that's why it's not harmful pag kanang pasugod pa lang siya or kanang not that kuan, but if in severe cases, yes, we have to do something for prevention for damage of your oral cavities.
Would you consider like kanibat murag clenched akong mouth and then gaana lang siya, wala kay siya galihok pero gaana siya slightly, and that's part of teeth grinding already.
Yeah, that's clenching already. That's teeth grinding
I'm
already.
grinding my teeth.
But it won't damage because our teeth can accept loads of force. So eventually, okay ra yun na siya.
Yeah, kaon man gani tagbukog, no?
Yes. Yes.
Okay, earlier you mentioned appliances, kana one of the things that we can use to treat teeth grinding.
Yeah.
Are there others, Doc?
Others,
Usually
it could
appliance
be,
are good.
for dental part, yes.
Oo.
And then others is you have to go for, like what I said, you have to seek for counseling
Oo.
for the stress.
Sa dental ra, Doc? Kung
Sa dental, usually appliance yun. And then, kung damage na ang teeth,
katong dentin exposed na, what
yes,
do we do?
we have to evaluate the severity of the exposed dentin or enamel. If it is very exposed, we have to do some root canal treatment. So,
Wow.
if ever we can put some crowns on it, para at least ma-preserve or mabalik ang occlusion sa patient.
Okay. Other than teeth grinding, no? What are the other common na mga oral health problems that we encounter?
Kana mga
Like gum problems kaha?
yeah,
Or
for
can it affect your gum, the teeth grinding?
not that much. It's because it is isolated on the tooth structures. Then, if you're going to say for a gum problem, so this goes for the hygiene. That's number one factor for the hygiene of the patient. So, of course, all of us has to have a good oral hygiene, and then we have to visit for oral prophylaxis or cleaning. So, gingivitis or gum problem will start with a simple bleeding. So, by that, pagpasagdaan lang, it will tend to become severe or worse na.
What's the severe or worse na gum problem?
Actually, daghan.
The more common na lang.
More common is tooth mobility. Manglihok na imong mga ngipon.
And then matangtang.
Matangtang na siya. So, naiuban na nagsayaw na akong mga ngipon. It's because of periodontal problem or the gum problem. So, deposit starts from the crown and then it will go down underneath. So, eventually, once the deposit or calcium deposit goes underneath, it irritates your gums or also your bone that holds the tooth.
Alright.
So, tendency for that one is it weakens your tooth already.
The most common cause of gum problem is oral hygiene. Good.
Oral hygiene.
Oral hygiene.
Good.
What happens if you have an oral hygiene problem and then you're a tooth grinder? Like, bad tooth grinder.
And bad oral hygiene. So, eventually, pag mata nimo, you have teeth all over your bed na.
Seriously,
So
Doc.
there's the tendency for that. Kasi syempre, if you have a bad oral hygiene, then you have your periodontal problem already. Tendency weak na kayo mga ngipon. Plus the load or the force that is exerted of your tooth, the tendency for that one is matangtang yun, mapirsa yung remove ang tooth sa imong socket.
Let's emphasize to our viewers, Doc, no, how important it is actually to visit the dentists. Okay? People manggo, they have this tendency to just go to their dentist when sakit na ilang ngipon, no?
Yes. Actually, that's very important. I kept on telling my patient na you have to be, bisag walay sakit, you have to see me. Kaya dili mo mga aonog ko, hindi pa may mamaak. So, cleaning is very important because even though you will brush your teeth every day, there's a tendency plaque will still stick on your tooth, and then eventually it accumulates. So the scaler, the instruments that we have, that's the only thing that we can remove the plaque or the calcular deposits. So every 6 months for cleaning is very important so that we'll be able to prevent any further problem that might happen.
If I'm a balik na po ko sa tooth grinding. If I'm a tooth grinder, how do I know nga, okay pa ko, I don't really need to visit you to have my grinding checked?
Actually, you'll be able to feel na you're in a severe tooth grinding if ever you're going to feel the symptoms like the headache, the facial pain, or the TMJ. So, of course, if you will feel this one every morning when you wake up and then sakit yung ulo and then there's pain on your face, so you will be questioning yourself, nga naman siya. So,
and then we need to visit you.
Yes.
Pero Doc, again, if I know somebody told me na I grind my teeth, pero wala naman ko na feel na pain, is it okay if I don't visit you?
You have to ask the one who told you kung pirmi ba. If ever your partner will say, yeah, every night, sige na ka-grind, sige na ka-grind.
But I don't feel anything.
Yes.
Let's just say,
everything...
I'm not saying I'm grinding my teeth, ha? Just for the sake of discussion.
No. It's because it will start from nothing. It will start from wala ra yun. And then eventually, because of the chronic symptoms, chronic conditions, mo abot kita. Kaya it will not become painful overnight lang. Okay, like what I said, tooth is covered with enamel, which is very hard. So, maghinihinay pa na siya ka-iban. Maghinihinay na siya ka-iban until once you will feel the pain, it means that we were inside the dentine or pulp already. So, if ever your partner will tell you that you are grinding every day already, even though you do not feel any pain, you have to visit your dentist. Para at least we can prevent any teeth damage or oral complications.
Okay. Is it possible for adults, when they were young, walay teeth grinding, but like 40-something na dito pa lang nag-teeth grind?
Yes, definitely. Kay tungod, some of our risk factors because of the medical drugs and everything. So eventually, possible.
Okay. Thank you very much, Doc. Now let's talk about the different services, dental services you offer here at Maayo Hospital.
Yes, in Maayo Dental Care Unit, we do all dental services. So we have specialized dentists that works on specific cases.
How many dentists do you have?
We have 5 dentists. So we have specialization, and then we cater from a simple oral prophylaxis to oral surgery to orthodontic treatment, and even for aesthetics, for veneers. So we do all of that here.
That's great, Doc. Any final message to our viewers?
Okay, so it is very important that we have to be aware of our oral health, because basically this oral health will be able to help us maintain a good everything will be okay, and then eventually with this we'll be able to prevent, because prevention is better than cure. So it is way cheaper, and then it is very it's like you will be able to prepare properly for everything. And then for that smiling, it boosts up your confidence also.
That's right. Oo. We don't want to be going to the doctor dito and the doctor would tell us na wala na yung chance. We just have to take away all the
Yes.
teeth.
Because
right?
there are lots of cases na ingana na they will go to the office because of severe pain already. And then, eventually, wala tayo mahimo.
And then they get to blame the doctor kay wala mo yung
Wala may
mahimo.
mahimo. Yes, kaya dili man may magician.
Oo, doc.
So we just do whatever's presented to us. So that's why regular visit, regular cleaning.
Yes.
Then if ever you will be able to feel something is off already, try to ask lang. Try to ask, try to consult, try to go further para at least you'll be able to stop the progress of the problem.
So the twice a year visit is really for cleaning and for checking.
Yes.
Right?
Yes.
Oo. Because again, we want to prevent things.
Yes.
Okay.
Yes.
Thank you very much, Doc.
You're
and
welcome.
we learned a lot from you today. Thank you for curing my curiosity about tooth grinding. And we hope to see you again next time. Thank you,
No
Doc.
problem. Thank you for the invite.
Thank you very much for joining us today. Please share this episode also to your friends and family so they may also learn from our topics today. Now, from their promise of Maayo, which in Cebuano means be well, discover a new healthcare experience here in Cebu at the hospital at Maayo. If you want to learn more about the hospital at Maayo, please visit their Facebook page or their website at www.thehospitalatmaayo.com or call these numbers below. I'm Cria Padilla Ruleda from CDN Digital. See you again next time.